Hello and welcome to Nurse's Handbook. Today we will be discussing some multiple choice questions from Community Health Nursing. Question number 1. Epidemiological marker for hepatitis B is HCV-C antigen, HBC antigen, HBS antigen, HbA1c. And the correct answer is HBS antigen. Epidemiological markers are biological markers used to characterize microorganisms or discriminate between genomes based on the genetic variation among microbial isolates. Serological markers for hepatitis B are HBe antigen, HBs antigen, anti-HBc IgM, anti-HBs, and anti-HBe. Question number 2. Sharkey's tape is used to measure mid-arm circumference, head circumference, chest circumference, body weight. And the correct answer is mid-arm circumference. Sharkey's tape method is a tool to measure the mid-upper arm circumference, which in terms helps to diagnose undernutrition. The scale has got 3 colors marking, that is red, yellow and green. If measurement is less than 12.5 cm, it comes in the red color, indicative of actively malnourished or wasted. If it is between 12.5 cm to 13.5 cm, it indicates moderately nourished or borderline. If it is more than 13.5 cm, it means properly nourished. Question number 3. Outdated cytotoxic drugs are disposed of by incineration, destruction and dumping in secured landfills, store for months then burial, autoclave. And the correct answer is incineration. Cytotoxic drugs are highly hazardous and should never be landfilled or discharged into the sewerage system. The disposal options include return to the original supplier or take-back program, incineration at high temperature, chemical degradation in accordance with manufacturer's instruction. In settings where high temperature incineration or chemical degradation is not feasible, encapsulation or inertization or alkaline hydrolysis can be considered. Question number 4. Residual chlorine after chlorination of water should be 0.5 mg per liter after half an hour, 0.5 mg per liter after 1 hour, 1 mg per liter after half an hour, 1 mg per liter after 1 hour. And the correct answer is 0.5 mg per liter after 1 hour. For normal domestic use, residual chlorine levels should be between 0.2 and 0.5 mg per liter. Residual chlorine is the amount of chlorine that remains in the water after a certain period of contact time. Question number 5. Polishing of the rice results in loss of which of the following nutrient? Thiamine, niacin, vitamin A, riboflavin. And the correct answer is thiamine. To whiten the rice, firstly the bran, that is the brown colored covering, is removed. Then the rice kernels are gently rubbed against each other. This removes dust, but at the same time it removes nutrients like thiamine. Question number 6. The most common cause of perinatal mortality is congenital, metabolic, birth injury, prematurity. And the correct answer is prematurity. Perinatal mortality rate is the number of fetal deaths past 22 completed weeks, that is 154 days of pregnancy, plus the number of deaths among live born children up to 7 completed days of life per 1000 total births, which includes live births and stillbirths. Question number 7. Schedule of administration of mini pill containing 75 micrograms of desogestrel for contraception is taken for 28 days with no pill-free interval, taken for 21 days with 7-day pill-free interval, once a day pill for 2 months plus 7-day pill-free interval, once a day pill for 3 months plus 7-day pill-free interval. And the correct answer is taken for 28 days with no pill-free interval. Mini pill comes in a pack of 28. Unlike other contraceptive pills, there is no row for inactive or placebo pills. It is important to take the mini pill every day and at the same time. If you take the mini pill more than 3 hours outside of your usual time, it may not work for preventing pregnancy. Use a condom or don't have sex for the next 2 days. Question number 8. On prescription of oral pills to the user, the health worker will ask about the following except swelling of feet, headache, calf tenderness, number of live children. And the correct answer is number of live children. Oral pill is a hormonal method of preventing pregnancy, and its most common side effects are nausea, breast tenderness, headache and migraine, weight gain, mood changes, missed periods, etc. Taking oral pills has got nothing to do with the number of live children. Here is the screening tool for appropriate use of COCs. Question number 9. Why injection vitamin K at birth is administered among newborns? To correct malnutrition, to prevent infection, to increase immunity, to prevent excessive bleeding. And the correct answer is to prevent excessive bleeding. Babies are at risk for vitamin K deficient bleeding for the first 6 months of life because most of the vitamin K the body makes comes from the food we eat and the healthy bacteria that lives in our intestinal flora. So babies don't have enough naturally produced vitamin K. Hence, there is a need to give injection vitamin K to newborn. Injection vitamin K 0.5 ml, that is 1 mg, is given soon after the birth. Question number 10. Integrated Management of Neonatal and Childhood Illnesses IMNCI includes the following except tuberculosis, diarrhea, respiratory infections, malaria. And the correct answer is malaria. The most common causes of infant and child mortality are perinatal conditions, acute respiratory infections, diarrhea, measles, and malnutrition. In mid-1990s, the World Health Organization, in collaboration with UNICEF and many other agencies, institutions, and individuals, developed a strategy known as the Integrated Management of Childhood Illnesses (IMCI). This strategy has been adapted for India as Integrated Management of Neonatal and Childhood Illnesses (IMNCI). The IMNCI clinical guidelines target children less than 5 years old. It has got 3 main components. Improvement in the case management skills of health staff through the provision of locally adapted guidelines. Second one, improvement in the overall health system required for effective management of childhood illnesses. Third one, improvement in family and community healthcare practices. Thank you for watching. For more updates like this, do like, share and subscribe the channel Nurses Handbook.